what can you do in your clinically to try to identify these patients? The easiest thing to do is run them through a few questionnaires. The first questionnaire, kind of standard, is the Epworth Sleepiness Scale. By a show of hands, how many of you guys have heard of the Epworth Sleepiness Scale? Very good. So we're good. Now, if you score really high on the Epworth Sleepiness Scale, this may be more than sleep apnea or something like that. You want to start thinking about CNS hypersomnia or narcolepsy. There's also the Stanford Sleepiness Scale, the there's so many scales, just choose one. But Epworth seems to be like what we do most of our research on. So you also want to screen for cataplexy, which is a little difficult. Cataplexy doesn't always present as someone falling to the ground and knees buckling. It could be very subtle, very subtle. It could be jaw sagging. It could be like a heaviness. It could be clumsiness and dropping objects, etc. Now, objective metrics that we use to diagnose narcolepsy include PSGs followed by MSLTs, more acronyms. So polysomnographies, which you guys know what that is. MSLTs are mean sleep latency tests, multiple sleep latency tests, okay, MSLT. And so the multiple sleep latency test, and we also have the maintenance of wakefulness test. But essentially what we do is we have the patient come in, spend the night, rule out sleep apnea, or if they have it, we treat it and control it. And then the next following day, we do 5 naps separated by 2 hours, 5 20-minute long naps separated by 2 hours. How many of you guys think you could fall asleep in 5 naps a day separated by 2 hours? If you know someone that can fall asleep in 5 naps in a single day in a bedroom, then we need to talk to them. Now, however, the other caveat to that is narcolepsy is defined as falling asleep and within 8 minutes on average between all 5 naps, and then having 2 dreams, or at least one dream in 2 different naps. And that's how we diagnose narcolepsy.